Welcome to this week's show, When Your Health Matters, the show designed to empower you to better health through knowledge and education. And I'm your host, Dr. Richard Huntoon from Advanced Alternative Medicine Center. We're located at 138 Canal Street in Pooler Park, that is in Pooler, Georgia. We're in Suite 404 of Building 400. If you have questions, love for you to stop into the office. But if you're a little reticent because of COVID-19 on going out into the public or stopping into a new doctor's office, what have you, you can certainly call me directly on my cell phone. My cell phone number is area code 845-561-2225. Again, 845-561-2225. Please don't text that phone, as that phone does not have the ability to receive texting, but you can email me directly at docrick@spineboy.com. That's DOCRICK@spineboy.com. And it would be my pleasure to help you to better understanding what the concerns you have regarding your health. This podcast, this video, whatever you want to call it, is designed to help you understand a different aspect of your health and what you can do to be proactive with your health. Today's class is specifically going to be on blood pressure, more specifically high blood pressure, also known as hypertension. Just appreciate the fact that hypertension is known as high blood pressure. They're synonymous terms. The simplest one is high blood pressure. The more cryptic one is hypertension. But we want to get an understanding of why that happens and what you can do to help yourself. So the first thing you need to appreciate about high blood pressure is the fact that over 70 million Americans suffer from what is considered medically treatable high blood pressure. That's with blood pressure above, your diastolic, which is the lower number, is above 90, and your systolic is probably above 140. Challenge is that if your blood pressure is, let's say, 140 over 90, that's not a medically treatable condition over in Europe. So if you're concerned about having high blood pressure because your blood pressure is right around that point and you don't want to take medication, just move to England. Then you won't be treated. Move to some other European city and then you won't necessarily be treated for it. So we want to appreciate that high blood pressure is known as the silent killer. Why is it the silent killer? It's called the silent killer because there are no outward symptoms associated with it. So you wouldn't necessarily know that you have high blood pressure unless you have your blood pressure taken. And we're going to get into a little bit later as to how to correctly take your blood pressure. But appreciating that having high blood pressure, known as the silent killer, manifests in a bunch of different ways. And it leads to some pretty devastating outcomes, which is why you want to be on top of what your blood pressure is doing. Number one, it's going to lead to hardening of your arteries. And when your arteries stop becoming flexible, well, that's obviously going to increase your pressure. So it kind of is a self-feeding mechanism. Once you have high blood pressure, chances are it's going to get worse. You may develop chest pain. You may develop a heart attack. And lastly, the one that you definitely don't want to have is you definitely want to have a stroke. So these are all the outward symptoms and effects of having high blood pressure for a long period of time. And so you want to make sure that your blood pressure is under control. Now, what are the risk factors associated with high blood pressure? Well, diabetes. Diabetes is a risk factor for having high blood pressure or hypertension. Diabetes seems to affect the African American population more than the non-African American population. I hope I'm being politically correct there and sensitive to everybody's perspective on that. Behavior, your lifestyle is going to lead to elevated blood pressure. Diet will simply, very certainly influence your blood pressure being normal or abnormal. How you maintain your weight. Is your weight being managed properly, or do you have weight management issues? Do you have obesity issues? These will typically lead to potentially high blood pressure. Physical inactivity. Are you physically active, or do you sit all day long at a desk behind a computer terminal and spend your whole life being sedentary, your whole waking life being sedentary? And then I guess you would be sedentary if you were sleeping too. So you don't want to spend your whole life being sedentary. You want to have physical activity. The use of alcohol. Alcohol is very detrimental to the body. Alcohol is one of those things that leads to increased blood pressure. It's associated with high blood pressure because sometimes people try to drink alcohol in an effort to minimize the stress that they have. Tobacco use. Tobacco use is associated with high blood pressure, and we want to make sure that if you are smoking, there's ways that you can learn to stop smoking. You could go the old school way, which is what my mom did. She just simply quit smoking, and nobody in the house noticed for at least 6 months until we had a dinner party, and my dad was trying to figure out where all the ashtrays were, and then became fully informed that my mom had stopped smoking. So you want to stay away from smoking and tobacco use in all of its various forms. Age, as you get older, your blood pressure has a tendency to go up due to the restrictions within your blood vessels as a result of use and abuse over time. So as one gets older, you should see your blood pressure numbers slowly creep up. Race or ethnicity. I always have difficulty putting those two together. So your race or your ethnic background is influencing a person's blood pressure, and as I said earlier, it typically impacts the African American population more than other races of people. And last but not least, family history. But you need to appreciate, if you read the wonderful book called The Biology of Belief by Dr. Bruce Lipton, who's a PhD, will help you disavow the being put upon you that your blood pressure is going to be elevated because your parents' blood pressure or your grandparents or your family lineage has high blood pressure. How one responds to their environment is learned behavior, and it definitely influences how the body functions, but just because your parents had high blood pressure doesn't necessarily mean that you're going to too suffer from high blood pressure, certainly if you lead a different lifestyle than your parents did. And last but not least, another reason for high blood pressure would be what's known as white coat syndrome. White coat syndrome has to do with having your blood pressure taken when you're in a doctor's office and your blood pressure being elevated simply because you're in a doctor's office. By being in a doctor's office, just the stress and tension of potentially being given negative news or life-changing health news stresses people out. So their blood pressure is usually higher in a doctor's office than it is at home. And so we want to appreciate the fact that just because you're in a doctor's office and they take your blood pressure and they tell you it's high, perhaps you want to get one of those machines that you can take your blood pressure at home and monitor it for yourself. But you definitely want to make sure that your blood pressure is within a normal level. What is a normal level? Well, ideally they'll tell you 120 over 80. All right, we want to make sure that your blood pressure is the difference between the upper number, the systolic, versus the lower number, the diastolic. You want to make sure that those two are within 30 to 50 points of each other. You take the upper number and subtract the lower number. Let's say the 120 over 80. You take the 80 subtracted from 120, you get a pulse pressure of 40. You want your pulse pressure to be between 30 and 50 millimeters of mercury. If it's above that, then your body's probably having more stress within the cardiovascular system, and you could rupture an artery, if you will. We don't want to do that. So, moving on to how does one treat high blood pressure? Well, there's two schools of technology, two schools of thought, if you will. There's the medical route, which is to put you on medication to artificially regulate your blood pressure, but taking medication, as most of us know, if you watch TV at all, it lets you know that there's a litany of side effects associated with the medication. The side effects associated with the medication could be coughing, having to clear your throat. You could get diarrhea or constipation. Those are two opposite responses, but they're basically controlled by the same situation within the body, and that has to do with affecting your gallbladder. We're going to learn about gallbladder during the month of May, but we can mention it here. Constipation and or diarrhea and or coughing could be related to gallbladder imbalance. Dizziness or lightheadedness as a result of taking blood pressure medication. Feeling nervous. That happens for a lot of different reasons, but associated with high blood pressure medication. Headaches. Again, these are gallbladder symptoms. Nausea and or vomiting. Skin rashes. It's a little hard to ignore a side effect of a skin rash if you can't ignore the skin rash. So then you got to figure out, well, what's creating the skin rash? And 9 times out of 10, it could be the medication that you're on. Weight loss or weight gain without any particular reason for why you would be gaining weight or losing weight. And last but not least, this is a male issue, but impacts the female part of society, and it's the erectile dysfunction. And having erectile dysfunction isn't happy for anybody involved in participating in that. So these are all potential side effects of taking medication specifically for high blood pressure. And so if you don't want to have those as a outcome, then you should do the other choice, which is to treat the cause, the underlying reason for having high blood pressure. And by addressing it at its source, then you don't have to have high blood pressure anymore. And so if you address the underlying cause, you eliminate the reason for having high blood pressure, you eliminate the need for medication, and you eliminate the harmful side effects that I just went through. And so understanding the why. If you don't address the why, whatever you have doesn't go away. So addressing the why becomes important. Addressing the adrenals, which is what regulates the sodium and potassium imbalance through a hormone called aldosterone in response to the stress situation going on. But having stress, you're going to have an increase in the aldosterone, which is going to cause you to conserve sodium and water with it, which is going to increase the pressure within your blood system, cardiovascular system, and drive your blood pressure up. But when the stress response disappears, you should have a situation called aldosterone escape, which causes you to get rid of the excess sodium and the excess water at the same time. And so your blood pressure should come back down to normal. The challenge is that we live in a very stressful society. We have two aspects of our autonomic nervous system. I think it should be called the automatic nervous system, but they call it the autonomic. And you have the sympathetics, which is your fight-flight response, which helps you deal with stress by increasing your blood pressure and allowing your heart rate to increase so that you can respond to the perceived danger. And then there's the parasympathetics, which is the relaxation, digestion, and healing response. And the challenge is that we spend what we should be spending 95% of our day in the parasympathetic response. We spend 95% of our day, even more than that, in the sympathetic response. So we're always in alarm mode, which is another reason for why our blood pressure increases, and we don't actually get the aldosterone escape, and our blood pressure never comes back down to normal. Those are some things that I can help you out with. Having digestive system imbalances, the dysbiosis associated with all the 14 or 15 different ways we trash our digestive system is another reason why we may have elevated blood pressure. Again, dealing with the sympathetic nervous system dominance instead of having parasympathetic nervous system dominance. And these are all the different things that go into why a person has elevated blood pressure. So supporting your adrenal glands, obviously supporting your kidneys, which is where the fluids get processed and excreted, and making sure that everything is working the way that it's supposed to. These are things that I can help a person with so that they don't suffer with high blood pressure. So how do you take your blood pressure appropriately? Well, you want to do it in 3 positions. You want to do it after you've relaxed for a minute, or 10. Take your blood pressure in a seated position, and your arm where they're taking it should be elevated to the height of your heart. Okay, and once they're done taking your blood pressure in a seated position, leaving the cuff on, have you stand up and take it again. And a lot of times people's blood pressure will dump. And what that means is they'll get lightheaded when they stand up too quickly. That's an indication of adrenal insufficiency, and you want to make sure that you address that. And if it takes 5, 10, 20, 30 seconds for you to recover from being dizzy from having gotten up too quickly, that indicates adrenal depletion, and you, again, want to address that appropriately. Now, once you've taken your blood pressure in the second position, right after taking it in the first position of being seated, take it the second position standing. The third position is to have you lay down. And when you take your blood pressure laying down, your blood pressure should come down. So going from seated to standing, it should go up 10 to 20 points. Going from laying down or from standing to laying down, it should come back down 10 to 20 points. And if you don't see that, if you see it going the opposite way, when you go from seated to standing, it actually dumps 5 to 10 points. That's an indication of adrenal insufficiency, and that's something that you would definitely want to address. And that's certainly something that we can help you address here in the office. The other thing we would like you to do is be physically active. Okay, exercise, best thing you can do to help get rid of stress. That's both mental stress and physical stress, as long as you're doing it in an aerobic fashion as opposed to an anaerobic fashion, and we'll get into that at another class. Maintain a healthy weight. I mean, stop eating all the carbohydrates, because when you consume carbohydrates, your body can't burn all of them, and you start to put on weight. Again, being physically active, eating healthy food. eating healthy food as opposed to all the completely refined and processed, or what I call the crap foods, is going to make a huge difference in what goes on in your blood pressure and what goes on in your health. If you smoke, find a way to quit smoking. Hypnosis works well. Like I said, my mom just quit smoking without having any issues at all, and nobody in the household noticed for at least 6 months. Um, Eliminate or greatly reduce alcohol. Alcohol is the self-esteem sugar substitute for adults, but it's not good for the body, and it's a way that people use to help manage their stress. But it doesn't get rid of the stress; it just drives it deeper inside and creates more reasons for high blood pressure. And last but not least, the thing that you also want to do is you want to check your blood pressure monthly. You want to definitely do that because the silent killer doesn't have any outward symptoms, and unless you know, you're not going to do anything to remedy it. So I think that's it for this week's class. I appreciate you tuning in. If you have any questions, please get a hold of me at area code 845-561-2225, or you can email me directly at docrick@spineboy.com. My promise is I will answer the phone, or I will get back to you at my earliest convenience. And my job is to want to help you to better understanding what the concerns that you have. So thanks for tuning in, and look forward to this class again next week.